Burns and scalds are common in children and young people, and we estimate that up to 90,000 children a year are burnt in the UK, and about 10 a day are admitted to regional burns treatment centres. The Children's Burns Research Centre is an exciting and innovative new collaboration between 4 universities and an NHS regional burns service, which aims to produce world-class research into the prevention and treatment of burns. Our multidisciplinary team aims to carry out research which will make a difference to the lives of young people who've been burnt. The research is divided into 3 main themes: the clinical management and treatment of burns, the psychosocial recovery and rehabilitation of young people who've been burnt, and most importantly, the prevention of burns and scalds in children.
The children who are at greatest risk of burns and scalds are 1-year-olds, either from pulling hot cups of tea on top of themselves or touching hot appliances in the home. We are working to develop prevention campaigns through education, working with families and parents to prevent these serious injuries. 10% of the children who have burns or scalds are suffering from maltreatment, either neglect or physical abuse. We've developed a risk assessment tool to identify these children early so that we can intervene to prevent further abuse and neglect.
23,000 children are seen in emergency departments in England and Wales every year with burn injuries. Most of these are small and scalds due to cups of tea. Currently, we don't know how to manage these in the United Kingdom. This is one of the strands of research we're going to do in the clinical theme of the Healing Foundation Children's Burns Research Centre. The other issue is we cannot currently diagnose infection quickly and accurately after burn injury in children, nor can we differentiate it from the normal inflammatory response. We're working with colleagues at the University of Bath, Dr. Toby Jenkins, to develop a prototype dressing that will be able to diagnose infection quickly and accurately, a smart dressing.
The psychological impact of a burn of any size can be extensive and enduring, and this can be a particularly difficult and traumatic experience for a child and their family. Our psychological research is looking at the factors that make a difference to young people's adjustment, and we're looking at the ways in which we can provide the best possible psychological support that will help a child and their family adjust to this experience and reintegrate them back into their school and social lives.
We believe our strength is our multidisciplinary team, with input from nursing, from therapy, from psychology, epidemiology and statistics, public health, surgery and paediatrics. And together, with support from the Healing Foundation, we aim to bring together this clinical and academic expertise to make a real difference to the prevention and treatment of children and young people who've been burnt and scalded.